Hi, I'm Kelly. Today I'm going to tell you about the Health Dynamics Inventory. The Health Dynamics Inventory, also known as the HDI, and I may refer to it as the HDI as well, is a brief self-report questionnaire assessment known to identify psychological or psychiatric symptoms quickly and accurately. It is often administered prior to or at the first meeting with a client to help assist in the evaluation process, as it quickly highlights areas that require further attention. The purpose of the HDI is to evaluate the three aspects of mental disorders as described in the DSM-5: the experience of emotional or behavioral symptoms, emotional distress, and psychological impairment. Key features of the Health Dynamics Inventory are that it quickly uncovers symptoms leading to guide an expedient diagnosis and intervention. It also serves well as a re-administered test throughout treatment to monitor symptoms changes and to document progress. And it also provides easy documentation of outcomes at termination. Key areas that it measures are the morale of the client, symptoms that are experienced globally, such as depressive symptoms, anxiety symptoms, attention symptoms, psychotic symptoms, as well as eating disorders, substance abuse, and behavioral behaviors. It also highlights the global impairment of occupational and task disabilities, relational and social impairments, as well as self-care disablement. Interestingly enough, the Health Dynamics Inventory is an assessment that can be taken by individuals that are 14 and older using the self-report, or taken by a parent of a child ages 4 to 19 using the parent form. It also consists of a background information questionnaire that systematically collects important demographic information and medical mental health history. It takes 10 to 15 minutes to administer, and it requires a B-level qualification to assess the outcomes. It has 49 to 50 response items, depending on which form you're using, that can be hand-scored or used in a software format that instantly generates interpretive reports or health summary reports that qualitatively compare numerically and graphically the individual's results with those in the normative sample. The normative sample of the Health Dynamics Inventory include 2,161 clients and 1,574 non-clients. The interpretive reports provide detailed information in the comparison sample at the scale and subscale levels that are indicated. I was especially interested in the validity and the reliability of this test and was curious as to what the author's process was in computing that. The authors of the Health Dynamics Inventory thoroughly evaluated the reliability of the assessment test by comparing the responses given by a sample of individuals seeking outpatient mental health services with a sample of non-patient individuals. The internal consistencies of the scales were computed using both Cronbach's alpha coefficient and the split half statistic, Gutman's statistic. In addition, evaluations were conducted using 3 sets of analyses to evaluate the validity of the items, scales, and subscales. Results indicated that the Health Dynamics Inventory scales and subscales are both psychometrically reliable and valid. Scientific validation details and diverse case studies are also provided in the HDI technical manual to show its application in a number of situations and contexts, and to clarify the use of the HDI in practice. Each of the self-test formats for ages 14 and older, or the parent form for children ages 4 to 19, cost $72, and the technical manual is available for $110. Thank you for listening.